topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good afternoon, Dallas-Fort Worth. This is the Ask the Expert show. I'm your host, Steve-O. We've got such a great show for you this afternoon. This is a show that's on everybody's mind, it seems. We do a lot on this show, talk about weight loss. And, you know, the big thing out is they call it the skinny injections now. We were so blessed to find one of the finest doctors in the Dallas-Fort Worth area. And I love doing the show. The only thing is it goes by really fast, but we're so blessed to have such a great doctor. Let me introduce you to our expert, Elite Care Clinic, Dr. Gamboa. Good afternoon, Dr. Gamboa.
Hi, Steve. How are you? Thanks for having me.
I got to tell you, you don't even know this. You are becoming such a big star. People, they love your heart. They love your personality. And they definitely love your information that you offer to people. We are getting so many new viewers and listeners. Dr. Gamboa, tell people about your practice.
Sure. Thank you, Steve. Yes, I'm a family medicine physician. My practice is Elite Care Clinic. We are here in Las Colinas at 1173 West John Carpenter Freeway. And our phone number is 469-947-6020. So I'm here to help you, guide you. And the most important thing is teach you and for you to understand what is obesity, how it goes in there, and how important it is to take care of our health.
Dr. Gamboa, we are getting so many people that have Medicare that watch the show, and they want to know what is the best way to choose your provider.
So nowadays, it's very complicated to navigate into that system because they have so many secondary insurances and it's very confusing for everyone. So I will recommend for them to, if they have chronic diseases and they take many medications, to talk to their broker and make sure that those medications are going to be covered, but not only covered, but also that they are not going to be an arm and a leg, because sometimes the brokers, they just want to sell you the insurance. They say, oh, yes, it's covered, but unfortunately it's going to be a tier 4, and then you have to pay a lot more money for the medication. So you have to be very careful. In terms of how to choose your PCP, you have to let your broker know if you were with a PCP before and you don't want to lose them. You have to make sure that that PCP is in network with that, because a lot of the doctors now, for example, in my case, I belong to the ACO with the UT Southwestern, so I'm able to see more patients from Medicare Advantage, with AARP, Humana, traditional Medicare. But there's some physicians that they are not with the ACO, and they may have limited, they only do traditional Medicare. They don't do the other ones. So they have to see what their plan shows them, or which insurance they have, and also which doctors they have, because also if they are going to a cardiologist, they're going to a gastroenterologist, make sure that all of them are still in their network and they're not going to lose a lot of them, because it's very complicated. Let me tell you that.
I listen. I got to tell. I understand what you're saying because uh, I'm on a HMO, and I picked the doctor looking at who the orthopedic doctors they work with, cardiologists, so I could stay with people I know. But turns out there's like groups within groups because
Exactly.
I said I would. This is the doctor I want. They said no, we can't send you to him. I said, but it's on the list. They said no, we don't refer to them. And I was
Yeah,
like, wow, that was the
it's
only
sad.
reason why I went with you. So, and you know what else we're getting? A lot of people, I think, because we have a big coverage area. We're at Dallas, Fort Worth, and people want to know about can they do telemedicine with you? One guy was in Garland, Texas, and he loves your show. And he
Oh,
said,
thank
can
you.
I do telemedicine with you? And I didn't know how to answer that.
Like usually, like what the now that the emergency state like has been lifted after the COVID, so some of the problems are like a little bit more restrictions with telehealth. So it will depend on his insurance if they continue to cover telehealth, because some insurance companies they stop covering it after the COVID emergency state was lifted. That's the number one thing. Number two, like I always prefer to see you at least once in person, like to establish care with me. And then after that, we can see some telehealth, like, and then I can see you in person maybe once every 6 months or once a year for your physical. But at least I have to see you once, examine you, make sure like your blood pressure is doing good, all those kind of things that I cannot do if you're virtual. And then later we can do telehealth. I have a patient that she lives in El Paso. She used to live here in Dallas, but then she moved, and then I see her probably once every 6 months. But the rest I do telehealth, and she's weight loss, and she's doing great.
Well, it's funny because all the letters we're getting about your show, they all start off saying, I love Dr. Gamboa. I love
Oh,
her.
thank you so much.
And that's pretty nice. The other thing we're getting letters on is people are concerned about this bird flu. Can you tell us much about that?
Like, so honestly, like I not too much into the bird flu. Yes, I heard that they was like getting worse and worse, and it was like more going to humans. But honestly, like I cannot talk to you much about it because I didn't really read about it or like get myself immersed into the data or anything like that.
Well, hopefully we don't have a pandemic with that also,
Hopefully
because what
not.
we
We
went
are
through,
over pandemias.
yeah, with
Yeah.
COVID and the things that we're finding out about COVID now
But
that
we're still
are
having it.
really,
I still have patients with COVID positive tests and symptoms,
you're
but they're
kidding.
very mild. No, they're very mild. Just like not long ago, one of my patients, he's a dentist, and unfortunately, he was having symptoms that it seems like it was only sore throat and a little bit of allergies, but he was not feeling great. And I asked him, hey, please get a COVID test because I have a couple of patients coming back from cruises that are similar like that, and they were positive. And yeah, sure enough, he was positive for COVID. So be careful. Like, but again, it's not as bad as it was, not near as bad as it was before. But still, we're gonna have some little waves here and there from COVID again.
Dr. Gamboa, how did you treat COVID?
Nowadays it's way different. We know better. First of all, I always tell
Yes.
them to go ahead and start taking emergency immune, the little packets, because it has vitamin C, vitamin D, and zinc. That's going to boost your immune system, anyways. And depending on your symptoms, also in your comorbidities, meaning if you have severe COPD, if you have obstructive sleep apnea, if you have asthma, if you have diabetes, then probably I will give you the Paxlovid to help you. Even though nowadays, according to the CDC, like the Paxlovid is not recommended as much as it was before, because most of us, we already received the vaccines. We probably at some point in our lives already got the COVID infection by itself, whether we were symptomatic or not. And then, so that's why we are going to be like less symptomatic, we may have a little bit of like sore throat, like maybe body aches, chills. Some people, they get a little sick with fever and fatigue for a couple of days. But like depending on where we are at, but if you're young, you've received all your vaccines, like you're doing really good, you're not having any shortness of breath or anything abnormal or worsening, then probably I'll just treat you as a normal cold and just monitor you. But if you have more things going on, you're older, then probably I'm going to be more inclined to treat you to prevent you from worsening.
Well, let's get to our big topic. And, I think I told you I'm on Ozempic.
Hmm.
Um,
How is that
and
working for you?
Dr. Gamboa, I got to tell you, this is the first thing I've ever done that has really worked. I mean, really, really worked. And I actually didn't do, you have to do it every week. I actually skipped a week just to see if I would gain weight, and I didn't. I was pleasantly surprised. I have not had any side effects. The only thing I would tell people is you've got to be patient because I
Yes.
lose about 1 to 2 pounds a week.
Yeah, and that's
And
exactly what we want, because we don't
yeah,
want you to be losing too much weight too fast. We have to give your body time for it adjust. It's going to like take time to get adjusted to the new weight. That's better because the faster the weight loss, the more adverse effects you're going to have. Like for example, hair loss. You're going to have like lose too much muscle mass. So we always have to make it gradual. We always have to make sure that you increase your protein intake so that we can recover like what we're losing. So yeah, so just smaller
I,
portions and everything.
you hear about people, the side effects are gastro problems. But I was just telling Rebel, our producer, I said, I wonder if people thought that they could speed it up and took more than like I started off with small dosage and worked my way up. I just wonder if people said, you know what, I want it to work faster, and they injected themselves with more than they should have.
It's possible, like as humans, unfortunately, we are impatient and we want changes right
Yes,
away. And we don't realize that
yes.
all this, we've been doing this for years and years. So, like, I would say, like, always be patient, exactly what you said. But always, that's why you have to always be by under a doctor's supervision as well, because you have to be going gradually up. Some patients, I mean, you're very lucky that you don't have the side effects, but there are patients that are very sensitive, and even with the lower doses, they have severe nausea or they have diarrhea
Oh,
or they have constipation. So, but that's why we have to go slowly, see what works for the patient, and that's what happens. So we always have to do gradually, and again, to what you said, it's possible that many patients did okay, yes, more is better, like with the vitamins, which is not true. So yeah, so sometimes it can happen. So that's why that just be patient, modify your habits, because there are other patients that they think that yes, like I'm going to be using the injections, but I can still drink my soda, I still can do my pizza. That doesn't work like that. You're going to feel sick, you're going to throw up, you're going to have diarrhea, you're not going to feel good.
I'm still blown away that what this does to your mind and your cravings. Because food that I mean, if I went for Mexican food, I mean, I could, one of those big plates of Mexican food. Now I look at it and I go, there is no
Nah.
way I can eat that. None.
Yeah, and it works amazingly like on that side too. Like, and there are like other medications that will also like enhance that. They work at the level of the reward zone. So that's why, like, I was reading an article the other day that was really surprising, that said that they were looking into the semaglutide or the this kind of like medications to maybe help people with addiction, because it works at the level of the brain for the reward zone. So it's very, very good that we're looking these medications into like other treatment areas, and the other thing also that now with these medications, you are on Ozempic, and then also you were mentioning about Medicare patients. Nowadays, like Medicare, it's covering Wegovy. So Wegovy is the medication for weight loss, but it's the same molecule, it's the same semaglutide. The only requirement for them to cover it is if like you already had a heart attack or you had a stent or you had a stroke, then you have like already established cardiovascular problem, and that's whenever they're going to cover it. But at least it's something, like we are going in the right direction. At least Medicare now is covering it, and hopefully the rest of the insurances continue to cover these medications that are saving lives in my opinion.
What's this? The new medication Zepbound?
Yes, the Zepbound is the name for the tersepatide. Tersepatide is the molecule, and it's like Monjaro is the name for diabetes, and Zepbound is the new name for the weight loss. But it's the two peptides in one. It's a little bit newer generation of the peptides of these medications, and the little advantage that has the tersepatide is that it also has a GIP peptide, that this peptide also helps with the insulin resistance. So it gives you a tiny bit more. So that's why it's a little bit more weight loss. But again, it all depends on the patient sensitivity to that, and also to the patient's willingness to improve their eating habits and their lifestyle. Because I had patients that they were on the tersepatide and they didn't lose any weight because they were still drinking alcohol, they were still eating processed junk food and not exercising as much. And again, the patient also has to put their little effort to help us.
So, do you think the Zepbound is better?
I wouldn't call it better. I would just say newer generation. It's like your iPhone. I always make this analogy. Like when you have the iPhone 7 versus the iPhone 10. It's still an iPhone, it's still really good, but the 10 is going to have a little bit better processor and it's faster than the 7, kind of like that
Wow.
analogy, because it's a tiny better newer generation. And it's two versus one, two peptides versus one peptide. So it's going to have a little bit better weight loss results than the one, but both of them are great.
One of the things that they do not say on the instructions is how long do you have to be on this for?
That's a great question, Steve. And I'm sure like a lot of patients have this question, and they do have this question also. Like the first question is, for how long do I have to be on this? So
Yes.
the question is, well, it depends. The question, it's not a straight answer, unfortunately, because if you have diabetes, then probably you have to be this for the longest.
Yes.
And then if you don't have diabetes and we're doing this for health reasons to like get you to your healthy weight, then probably like you have to be in this for at least like maybe 2 3 years, depending on how fast we get to your healthy weight, and then also how good we are on maintaining your weight. So if we're able to maintain your weight for at least a year or so, then probably we can slowly taper you down from the injections. So that's why we also like ask the patients to consume protein, to make sure that you do resistant exercises so we don't lose muscle mass, because then your muscle is the one that is going to help us maintain and keep the weight, keep the weight off and then maintain your weight. So that's what we always like recommend patients. But it's going to be for some time. It's not going to be only 2 months, get into that dress that you want and then you stop. So that's not, these medications are not for that.
Okay, here's a tough question. So, there's a lot of people who just don't like to work out. And when we talk about weight loss, it's, diet, workout. I got to tell you, I have not worked out one day. The only reason why I'm watching my diet because nothing looks good to me anymore. Why am I losing so much weight?
Well, The thing is that you're going to lose weight because if you think about this and you said it, you're not able to eat the whole amount that you were before. So yes, we are restricting
Right.
your calorie intake. By doing that at the same time, if we don't do enough of protein, your body is going to start consuming your muscle as protein. So we don't want to lose the muscle mass. So Steve, I will strongly encourage you. You're not my patient, but like I want you to do
Yes,
better.
I am too.
At least, at least go ahead, and you don't have to be 1 hour in the gym. So please, like, go ahead and do, like, I was listening to a webinar like earlier today that they were saying that the patients did better if they did short bursts of little exercise versus like being 1 hour in the gym. So like, let's say if you like for 15 minutes, you just do a little bit of resistant exercises, maybe one of those YouTube videos that are toning your arms. You don't have to be an hour or anything. And then the next day you do like maybe a 20-minute walk. So like little things like that are going to stimulate the burning of the calories, stimulate your body, like, so it's just a little bit. You don't have to, again, be 1 hour at the gym and paying a membership that it's like on top of everything more money these days. So you just have to be a little bit more active. Just walk 15 minutes. Whenever you get home, do this little resistant bands or like little weights, but just do something because we don't want you to lose the muscle mass.
Gotcha. What is intermittent fasting?
The I Good question. Like, because it's very, very interesting, and now it's been getting more and more popular. So, intermittent fasting, basically, as the name it says, is that we are going to eat on a designated time of a day. For example, like the time period that I really recommend and I like, and I do this like from time to time is uh, to stop eating around 6 or 7 p.m. and then you start eating around 10, because you want to have 16 hours of not eating. So that's the easiest one for me because you're sleeping the most of the time. So it's easier for me, so I don't have to be thinking about, oh, I cannot eat anything. So you just eat something around 10, like preferably protein rich breakfast. And then in this 16 hours you are basically like forcing your body to use the fat as energy. And whenever what do you do between waking up and 10 a.m.? So you can drink all the water, coffee, tea, but zero sugar, zero carbs. So in that way, again, your body uses the fat as energy. Some studies have shown that this type of dieting, or like uh, it can help with decreasing the insulin resistance. It helps on those patients. So you can do this 2 times a week, and it's easier whenever you're taking the injections. So that's much easier too whenever you're with that. So yeah, give it a try, and it works pretty good. And this is also like another strategy that we use to maintain the weight.
Your show, so everybody knows, it's the last Wednesday of the month at 4:25. We are getting text in. People want to know about foods to eat, foods that are good for you. So on our next show, can we talk about diet?
Yes, let's talk about diet. What is good, and great that you mentioned this because again, the webinar that I heard like from this like very like famous doctor, and he was like giving this webinar. It was on Facebook and Zoom and everything. Like it was like transmitted internationally. So he was talking about the Paleolithic diet. So we're going to talk about that next time, and also
Good.
I'm going to want to talk about the thyroid next time because that is so important for everyone because that is kind of like the one that takes care of the metabolic rate in our body. So we're going to talk about that, and that's going to be very, very interesting.
Tell people, we've got a minute left. Tell people how they can contact you.
It's Elite Care Clinic in Las Colinas, and the phone number is 469-947-6020.
Dr. Gamboa, we are so lucky to have you.
Thank you,
We'll see
Steve.
you next month. Have a wonderful 4th of July.
You guys too. Take care.
Thanks,
Thank
Dr.
you.
Gamboa.
Bye.
That's our in-house physician, Dr. Gamboa. That's it for us today. Everybody have a wonderful 4th of July. We'll see you next week with more Ask the Experts.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.